Dr. Kelley, I don't want to brag too much about you, but not only are you a medical doctor who graduated from Ohio State University, not only are you a 10-year member of the Institute of Functional Medicine, but you're also the treasurer for the International Lyme and Associated Diseases Society, which we know is a really prestigious position. And we want to thank you for dedicating your time to do that and help us in this chronic Lyme community. I mean, you're a founding member of the Academy of Integrative Health and Medicine. You're on the faculty at Feinberg Medical School. I mean, it goes on and on and on. You worked at Whole Health Chicago, Michigan Avenue Immediate Care, St. Joseph's Hospital. So then you went on, of course, to form Case Integrative Health, where you are today. And your wonderful practice helping a ton of people in the Lyme community all over the world that come to see you. So it's an honor. You've been on our Lyme Hackathon now in May for Lyme Awareness Month in 2020, 2021, 2022, and here again in 2023. Your Lyme Hack just went up a few days ago. This is our fourth podcast interview with you. Your first one was, and this is a good one, folks, this is the personal story of Dr. Casey Kelley, episode 98 of our Tick Bootcamp podcast. And then the last 2 years, we had you on for episode 170 and 275 for Lyme Awareness Month with this Instagram-style Q&A. And that was a really fun, informative chat that's on our podcast as well. And we really want to jump right in. So, Rich, you want to pick it up with the first question that you got for her?
Let's talk about what has developed in the Lyme community over the course of the last year since we've had the good fortune of interviewing.
We're still, lacking in lab testing for sure, but I do see momentum coming. I see a lot more research about it. I see science coming behind it and really starting to kind of push that forward, which is really exciting from a provider standpoint as well as a patient standpoint, because if we can get more definitive testing to know acute, chronic, persistent, gosh, that would be a game changer. So I'm excited to see some of that happening. I think too, since just the pandemic in general, I think that there's definitely been a mind shift change about the immunological ramifications of an infection. And so we're seeing a broader reach of individuals and research and other things where people are understanding that. And we in the Lyme community have known that for a long time, right? So we're really kind of glad to see those changes too. There's definitely some research still coming out with different treatments and protocols, but there's still a lot to go with all of this. But I see things moving in the right direction, which is really exciting.
It is really exciting. And Matt, if I could just make one more observation. I mean, I think we are certainly moving to a place where folks recognize that Lyme disease is a chronic disease, right? And for a long time, we've had to sort of fight that fight, and it does certainly crop up every once in a while. I mean, Matt has been wise enough to post the 700 peer-reviewed studies that certainly support that Lyme disease is a chronic disease. We've actually, we've been beating the drum on defining Lyme disease only as a chronic illness, and we'll talk more about that as time goes on. But I think that's really been one of the most positive developments since COVID, that we seem to be battling that element of this battle less often than we had just a couple of years ago.
Yeah, it's exciting, actually. It's good stuff.
So I want to circle back, Dr. Kelley, to your talk about science, right? And science finally catching up a little bit to the Lyme community. And just last week, the CDC backed a study that came out talking about this interferon alpha, which is an immune marker they found in every single chronic Lyme patient, or as they called it, PTLDS treatment patient, right? So this is exciting in many ways because people think it could be, used to develop a treatment for people that are suffering with persistent chronic Lyme symptoms. But on the other side, it always makes me anxious because is this going to be, a false belief that there's going to be a magic bullet for chronic Lyme, right? I think it can be helpful, but I want to be careful to not overestimate the power of this discovery. So what are your thoughts on this? Can you give us some insights? And am I wrong? Do you think that this is something that can have some power and some oomph behind it for our community?
I wish there was a magic bullet, but I think that these infections are way too complicated and complex for that to work for everybody every time. The terrain is so different in every person who gets this. I think part of what makes chronic Lyme and vector-borne illnesses so complicated is they're so different in every patient. Depending on, is it just Lyme? Is it Lyme and Babesia? Is it Lyme and Bart? Is it Lyme, Babesia, and Bart? And what's underlying the terrain, what other, gut disruption they have or neurological disruption. There's so many layers to this. You have to really, in my mind, really have that integrative mindset of the system as a whole and be able to look at everybody individually to really get in and deep and change it. So for some people, there might, this is a possibility. This is an immune, trying to look at that immune dysfunction that happens and repairing that, which is awesome and a huge part of what we have to do to heal this. But I would hold my breath about like a magic bullet for anything, just because it's just too complicated. I wish it were that easy. I really, truly do. I fear that it's not.
So, Dr. Kelley, one of the things that we are doing is challenging people to redefine Lyme disease, right? And I think one of the reasons why a practitioner who is not as well versed as you are in Lyme disease, just a general practitioner who is presented with the symptoms, is always going to struggle with diagnosing someone with Lyme disease if they don't have a definition, right? And we've had a debate with a lot of different experts in this community about what Lyme disease is. And our position at Tick Boot Camp is that Lyme disease is a polymicrobial, multisystemic, chronic infectious disease. What's your reaction to our definition of Lyme disease? And do you believe that if that definition were accepted by general practitioners in the community in general, that we would put ourselves in a position where we're more likely to be diagnosed with Lyme disease clinically, even if we haven't gotten to the point where we can develop the kinds of testing that you spoke about earlier?
We use Lyme disease as an umbrella term quite often, in this community and outside of the community, even people who don't necessarily know they're using it as an umbrella term, because technically it's Borrelia burgdorferi. I mean, that's Lyme. But in Europe, they call it borreliosis because there are multiple Borrelia species that cause human infection, human disease. And most patients don't just have Borrelia. They have a handful of Borrelia and Babesia and Anaplasma and all these other infections and viruses and Candida and, all these multiple critters kind of hanging out in their system. So I agree with you. I think that it's more than just Borrelia burgdorferi for sure. And I think that's part of what makes it so complicated and complex, because it tends to kind of get pigeonholed as that one thing, and it's not just that one thing. And it is multisystemic, and it is multifactorial, and it is all of those things, which makes it hard to diagnose and makes it hard to treat too.
So Matt, let's talk a little bit about the terrain side of things, right? Because of course we do have this polymicrobial infection, but it's not just the microbes that are spit into us by either the tick bite or multiple tick bites, but we could be harboring, and we are harboring, a number of different microbes in our system just by living life, right? And our immune system is managing that until it can. But one of the things that we've learned from some of the interviews we've done, especially with this great interview we recently published with Dr. Ava Shoppe, is that she talked about how the microbe load that we're already carrying will then, in many cases, work with Lyme to break down our immune response or destroy our capacity to defend us. So you can first talk to us a little bit about how the germs that are spit into us by a tick bite combined with the other microbes we're harboring, and how that makes it even more difficult.
Yeah, it's kind of mind-boggling sometimes, but if you think of your body as an ecosystem, like, we're full of non-us, right? We've got all kinds of bacteria, parasites, viruses, the whole works in our system. And some of them work for us, and some of them work against us, right? And that combination is going to be different in different people. And so the response to a new infection is going to be different in different people, in part because of that, because of what's already there. And I will describe it sometimes as immune system whack-a-mole. When your body's busy trying to treat one thing, something else pops up, so it's always trying to kind of like keep on top of all of that's exhausting for the system to handle. I think of the terrain as my current ecosystem with all the good, bad, and otherwise ugly bugs, right? And then my system. So what's the health of my gut? What's the health of my nervous system? All of that compacted on each other, like, that's my starting point. And then you throw Lyme onto the mix, what happens? And that's part of why it's different in every person. That's why it doesn't present exactly the same in every person, because it's so complex and difficult. And Lyme is smart. Borrelia burgdorferi is smart. And it's terrifying and elegant and beautiful all at the same time. And so I can be kind of enthralled and like, wow, how can it do all this? And then go, oh my gosh, How does it do all this, right? And that's part of what it does, is it talks to other bacteria, other viruses. They combine in the biofilms and they share information and they get smarter. And it just compounds, and it's wow. But wow.
Yeah, I mean, Dr. Alan McDonald calls it a diabolical disease or a diabolical bacteria, and I think that's a good way to put it. But I want to bring this back to the theme of Lyme Awareness Month for us at Tick Boot Camp, which is the hackathon, right? What are some Lyme hacks and tips we can give to the community? And I really loved your hack, Dr. Kelley, which was really about the nervous system and regulating your nervous system. And this ties into a community question we got when we did a poll for this live event from regarding healing depression from Lyme disease and using neurofeedback from Leslie Les 765. And the question we want to ask you is, what are some techniques you recommend? Because in your Lyme hack, you talked about things like binaural beats. You talked about some brain rewiring programs that are a little more rigid, like DNRS and Gupta. But a lot of people DM'd us and commented saying, well, what are some of these apps Dr. Kelley is talking about? And could you go a little bit deeper into why it's so important to address these things if I'm trying to kill the thing that's making me sick, right? There's a lot of questions we got there. And if you can give us some more meat on the bone with that topic to help us and help us learn from that.
Yeah. When we're sick with these chronic issues, we live in fight or flight. Our cells are in danger mode, literally, and they get stuck. And that affects our nervous system, gets stuck as well. And our nervous system and our immune system are intertwined. You know, they're not really separate, they're together. And our nervous system really thinks it's helping us by sending out inflammation and, you know, trying to respond to all of this. And we end up in this perpetual state of, you know, fight or flight, like you can't stop. And some of us actually even move farther into freeze. I've been there, you know, looking back, I was like, oh my gosh, like I was in freeze, like you can't do anything. And so part of healing from all of this and healing and repairing the immune system is healing and repairing the nervous system. And just, you know, giving that nervous system a chance to go, even if it's just for a second, you know, giving it that break. And so there are lots of tricks and tips and things out there. And I usually, it depends on how sick people are, but I typically will start with a lot of the more passive ways to support your system, because that's more of what people can handle initially versus more of the active primal trust or DNRS, like that, like we're kind of diving into some of that trauma and toxic thoughts. But binaural beats are a great way. You just sit and listen to music, you know, and you can do it while you're asleep. It helps to reset your brainwaves. It's different tones and different ears that helps. It correlates to a very specific brainwave that is either to focus or to sleep, or, you know, however you want to do it. There's an app called Brain Tap Pro for that. There's a lot of research behind that. They also have a laser eye thing that you can get as well. I found that to be way too much for me when I started. There's also Insight Timer. That's one of my favorite apps. It's free, and there's loads of binaural beats on there. You just search in there for binaural beats. I also really like tapping. I think tapping is a nice, pretty passive way to work into this. And there's loads of free stuff on YouTube for tapping. There's an app for tapping too, the Tapping Solution, but that's using different acupressure points to calm the nervous system. I find that's a pretty good regulatory deep breath. You could, you know, search on YouTube for tapping for sleep, tapping for anxiety, tapping for immune support, whatever you want to focus on. There are a fair amount of vagus nerve exercises available too. And I'm sure you can Google all of this too. I've learned it from some functional medicine neurologists, some neurochiropractors, where you kind of look at, you know, your thumb and move your head and kind of focus and do some different shifting there. That can also really, you know, calm the system. So those are some of the passive ways. I've had people go to hypnosis. That's fairly passive too, but can be pretty wonderful for some changes. So there's a lot of different ways to do it, but it is a part of the process.
I just wanted to segue this because one of the things that I know I'm not doing a good enough job with in this community is being sensitive to the fact that although there's a great benefit to brain retraining and nervous system regulation techniques, many people come at us and say, hey, look, I'm really physically sick, and I feel like you're making it less significant that I actually have a real illness. And I feel like you're making it less significant that this is a serious disease. You would never go to somebody who has cancer and tell them, focus on mindset, focus on your nervous system. And I want to argue that maybe we should be. Anybody who has any kind of illness, and even somebody who is healthy and not experiencing any symptoms, would benefit from all these techniques. But I believe that adding these techniques on top of whatever we're doing to treat Lyme disease as well is going to help us get better quicker. I mean, what are your thoughts on that? Can you help me explain that better to this community, how this is not the sole source solution, but this is something that will supplement your healing and your treatment protocol to get you to your goal quicker?
Yeah.
But Matt, can I, Dr. Kelley, before you answer, I do want to add something to that, and that is, this may be a different disease than other diseases, right? Because you are going to have bugs in your brain with this disease, and you're not, in many other cases, going to have that as well. And because there are bugs attacking you as opposed to some other types of diseases you may have, it may not be triggering, and you may not find yourself in fight or flight. So this may be different, and that may be the reason why you have to do that, even if it's generally a good practice.
I mean, there's actually a plethora of research about meditation and cancer. There's a lot of research. There are, a lot of more holistically minded cancer centers, especially, that are preaching, you got to meditate, you got to do this. It's like they understand that that's a part of this process as well for other chronic illnesses. And I agree. I think this is a part of every chronic illness. I just try to make it a point. I've learned over the years to explain it a little bit better, but I still always try to say, look, I am not saying you are making this up. You are not making this up. This is real. It's physiological, and your nervous system is doing its best. God love it. It's doing its best to try and help you, but it's gone off the rails, and you thankfully have some control to get it back on the rails. And you can really help yourself get better faster if you start to employ some of these tools to help yourself. But it's a piece of the puzzle, right? It's not going to fix everything, but it's going to help you feel better along the way. And the people that I can convince to do this work get better faster, stay better longer.
Yeah, why don't we talk a little bit about, I want to revisit a topic we talked about last time, which was prehabilitation and getting yourself ready for the battle. We've had many occasions to interview folks who have gone aggressively into treatment and they've gotten sicker. And I think there isn't enough conversation about prehabilitation. It's actually something we interviewed your colleague, Dr. D.T. Agarwal, and she had shared with us some of her thinking on prehabilitation. We started to research prehabilitation, and we think that really should be a vital part of everyone's treatment plan. I'd like you to talk a little bit about prehabilitation.
Yeah,
and how you use
we approach everybody
practice.
Uniquely here, and there are people who we can go ahead and start right away with a medication or an herb or something. But there are a fair amount of people that come in and we say, gosh, I can't give you treatment yet because it will crush you. And that is not good for anybody. And it's not going to help. It's just going to be a mess. And we don't want that. We want to help you get better. That is hard for some people to hear because they finally have an answer and they just want to move forward. But a lot of that time, they're just really sensitive to everything. You open a bottle of minocycline antibiotic in front of them and they hurt, right? And so you cannot just jump into it with every patient. There's the right patient and the wrong patient. Some of that's just good clinical, wherewithal and learning about this along the way. But some of the big areas to really prepare yourself is, one, make sure you're eating the right foods. Food is medicine. A lot of times we have to start with gut healing and getting the gut in better working order, because that's where most of your immune system is. So if your gut isn't working, your immune system isn't working. So that's going to make it harder to fight these no matter what antibiotics I give you, right? And the other big one is detox. Supporting that detox, making sure we're opening up the detox pathways gently but effectively as much as possible ahead of time will really help people tolerate the treatment. So it's not unheard of that we take several months to really get people to a spot where they can handle treatment. And often just by doing that work, people start to feel better because we're opening up, or freeing space for their system to be able to start to tackle this on their own.
Rich, I'd like to circle back real quick to one of our community questions, because we have Leslie Les765 on, who is one of the person who submitted questions earlier on. And she wants to know, Dr. Kelley, if you can just talk to us more specifically about neural feedback and what your thoughts are in using that as a specific treatment protocol and an aid in Lyme disease.
Absolutely. So we have microcurrent neurofeedback in our practice, and it's a little different than traditional neurofeedback. Traditional neurofeedback, you sit with a bunch of electrodes on your, on your skull, and you stare at a computer screen. You actively try to change your brain waves to get to a more relaxed state or more focused state. It works. There's a good amount of research for this. It can take a really long time to really see those changes and get them into effect. And it's hard, especially if your brain isn't working on all cylinders like most of our Lyme patients are. So we started using microcurrent neurofeedback, which is much more passive. It's microcurrent. I mean, it's, a million times less stronger than your cell phone. It's really not a lot of electricity or current that you're getting, but you just get to sit there. You don't have to think, you don't have to work, you just get to relax. It takes about 30 minutes or so to do the procedure. And we start low and we kind of work our way up. But this will very passively start to change those brain waves for you to get them. And like my visualization of this, and I don't know how right this is, but this is kind of how my mind works. You've got these jagged, anxious, inflamed brain waves, and it starts to just kind of help get everything a little more balanced. It helps neurotransmitters get more balanced. But more importantly, what this one does that regular neurofeedback doesn't is help to detox the brain. It opens up lymphatic channels to help the brain detox, and it's hard for the brain to detox. That blood-brain barrier makes it hard for things to get in. It also makes it hard for things to get out once they're in there. And so we have really seen some big changes due to that. We also, at our clinic, we also give everyone charcoal afterwards, and we have them use molecular hydrogen, inhaled molecular hydrogen afterwards. So again, this is my brain and how I wrap my head around it. We're kind of shaking the snow globe a little bit with it. And you can get an overstimulation from neurofeedback. But once we started using the charcoal and the hydrogen, we have not seen that ever happen. The hydrogen molecule is the tiniest molecule, and it crosses the blood-brain barrier. And what it does is look for cytotoxic radicals and turns them into water. So all of that kind of snow we just kind of released, it turns it into water. And so it's also just in and of itself very soothing and calming, and people have to pee afterwards because they made a lot more water. But between those two things, where we've got a little bit of a sponge with the charcoal, we've got the hydrogen, we don't see overstimulation. Anxiety gets better rapidly within 1 to 2 treatments. We're seeing changes with anxiety. Energy gets better, mental clarity gets better. It's a great addition to our resources here.
So I just want to ask, because we had a question about rife, but frequency therapy in general, because we know there's PEMF therapy, we know there's the M coil, we know there's rife. And, Allie, Rich, and I are testing out the Nikki, right, which is where we're having so much fun with, and the different frequency modes that help you with various things. And it seems so crazy to me that frequencies can be healing, because we know there's bad frequencies, like maybe things like 5G and EMFs, and then there's good healing frequencies, or even frequencies that can help maybe kill viruses and bacteria. Can you just explain for us what is frequency therapy? How does it work? And then your views on the various products out there, from, the Wave device, the Nikki, PEMF, M coil, rice, et cetera, et cetera.
Yeah. Yeah, actually it's interesting because I am getting a frequency specific microcurrent device kind of brought in actually in a couple weeks, and I'm going to get to play with it a little bit from a physical medicine and rehab doc. He's going to help share and teach me about it. I'm very fascinated, about this. These things are used in hospital settings these days for chronic pain, especially, is where a lot of that research is done. And we have a lot of people with pain, right? So in and of itself, like, there's a lot of research and evidence behind this stuff. And so I am still a newbie at really looking into this modality and the research and how it works and how to use it and how to help patients, benefit from it. So I'm really excited to bring this on and learn more about it. I love geeking out and learning about new things. Just the experience that I've had with patients doing this, I have a good handful of people who do rife. And I've seen some herxes. Like, I've seen some big herxes from this. It's pretty impressive. You're like, wow, but I've also seen people do really, really well with it. So, I think in the right hands, it could be a very powerful tool. I want to believe that it can't do much harm, but I can't say that it can't, because like you said, there's good frequencies and bad. So, I think you have to be with somebody who knows what they're doing to really kind of figure that out. So yeah, you guys will have to let me know how you do with yours. Yeah, I'm really interested. It's a really interesting area of science here. So
when you were in medical school or at any education level, was the electrum something that you had studied? I mean, we know, of course, about the biome, and that's something that we're all generally aware of, but the electrum seems to be something that we're now starting to become more aware of. And yeah, just wondering whether or not that was a part of your educational experience. And if it wasn't, why do you think it wasn't? And do you think you functional medical docs are now just sort of blazing a new trail here and starting to recognize that we are energetic beings? Our cells have little power plants in the mitochondria, and it certainly does make sense when you have all this gunk in your cell, whether it be in your cells, whether it be the bugs or the the many other things that they develop inside of our cells, how that might have an impact on our ability to be energetic. And we do know that the number one symptom that all Lyme patients have in common is fatigue, and this sort of all seems like it should be coming together, and this may be a really rich area of
no pun intended there,
folks dealing with Lyme.
I did not learn about that, and I didn't learn about Lyme disease in med school, though. To be fair, I mean, I think it's cute that you think I'm young enough that I went to med school and this would have been around at the time. So thank you for that. No, yeah, I didn't. I didn't learn about a lot of this stuff in med school, though. I really had to go out on my own and be curious and think, this is not enough. This is not helping people the way I want to help people. Like, what else can I learn? And that's how I really got into integrative medicine in the first place, was that curiosity. And then it, trickles down and brings to Lyme every time. And there you go.
To follow up with another community question, I think this is a really good one. The question is, we have certain intolerances as Lyme patients, and even as we get better, some of those intolerances remain, and it's hard to balance life with those intolerances. And specifically, this question from Cabral Diniz, and I'm sorry if I mispronounced that, is when we have a sun sensitivity, and we're outside and we have a flare-up. Is it really a flare-up? Is it just a symptom flare? Or is it actually maybe a Herxheimer reaction from the sun helping our bodies flush, kill the bacteria and get all the stuff out of us? So the curious, is it a flare or is it a Herx from die-off when we're out in the sun? And what's really triggering the heat intolerance that so many of us in the Lyme community have experienced?
Mm-hmm. I'm not sure that flares and Herxing are necessarily different. I mean, at the end of the day, in my world, these are all cytokine storms. These are immune reactions. What's triggering it doesn't matter. I mean, a lot of the same things that are going to treat a flare are going to treat a Herx with that terminology. So, it's an overabundance of a reaction in our system. It's not necessarily a bad thing. We want our immune system to respond. It's just, it's just too much for our system to handle. And it can be really hard to tell what the difference is. And, it also can be sometimes it's a flare, sometimes it's a Herx. Like there's no black and white answer here. It's very gray, and there's still a lot to learn about what it all actually is. But the good news is the things that are going to help are going to help. So you still have to learn kind of whatever it is for you, why you're feeling bad. That Herx support, that toolkit that you have that you can kind of pull out of that box when you need it, will help in either situation usually.
Jason's got a good question here. What are some of those things? If all of this is a cytokine storm, it's inflammation. So I'm out in the sun and I'm feeling cruddy. It's from inflammation. What can we do? What are some cheap and affordable things I can do, either buy over the counter or, just do that I have in my house potentially to curb the inflammation, so maybe I can enjoy a little bit of sun if I'm still heat intolerant?
Yeah, exactly. So I actually have a little detox lemonade that I like a lot. Juice of half a lemon. You can do anywhere from a teaspoon to a tablespoon of baking soda, and then 2 to 5 drops of stevia in some water, and you can make it hot or cold. That actually is very alkalizing and soothing. You do want to be careful with your teeth. If you're drinking a lot of lemon water, maybe use a straw. That's a very affordable way to help support this. Alka-Seltzer Gold's a good popular one. It's very similar. It's that alkalizing formulation. Epsom salt baths can be great too. Not so great if you have a really big heat intolerance issue, because they can make things worse, or sometimes worse with POTS. So let's see. There's a handful of supplements that are also very useful. Berber Panella is a really good one by Nutrimetics, 20 drops up to 8 times a day. Glutathione up to 2,000 milligrams a day. SPM Active. So these are specialized pro-resolving mediators. Now there's several companies that are making these now. SPM Active is kind of one of the original by Metagenics. These are from fish oil, but not fish oil. They resolve inflammation that's already there. When you're in a flare, when you're in a herx, you're inflamed, right? So this helps to clear out the inflammation that's already there, and you can do 2 pills up to 3 or 4 times a day. You know, you just have to kind of play around with some of these things. Even, you know, with a Babesia flare, Benadryl can be really good. So sometimes you just have to kind of play with different things and figure out what works for you, and then have that as your go-to.
Something that always fascinated me, and I've learned it, and I honestly forgot because it was last year. How is lemon good for a herx? Because we generally think if it's acidic, it creates inflammation. That's hospitable for disease, right?
Yeah.
And yet it's very good for herxing. And you talked about Alka-Seltzer Gold, which is, you know, it alkalizes your body, and that's good. So how does lemon and lemon water help when you would think it's acidic and it's not good for a herx, right? That's always interesting to me.
Because it's not acidic in your system. It's actually alkalizing.
Although it can create canker sores and it seems acidic, it's really not once it gets into your body.
Once it gets in. Exactly. Yep.
And the second follow-up to this question, though, is Ava Shapi, and this is, you know, from many, I'll say at least a couple of years ago, she did that accidental study where she found that stevia not only brings out the Lyme bacteria from the cyst form to the spirochetal form, but it actually killed it under a microscope. And a lot of people think that may not be 100% accurate. There's a lot of debate there, but do you put stevia in your cocktail you describe because you think it has antimicrobial properties and can help bring the Lyme out and kill it? Or is that just something that was a happy coincidence there and not related to that research?
It's a little bit of both. One, it's like sweet without really affecting your blood sugar. But when we take stevia orally, we don't really absorb it. It stays in your gut. That's one of the reasons why it doesn't really affect your blood sugar. So it might help with biofilm or other things in your gut. I'm really not sure systemically in vivo in a real life person how much it's actually doing inside your cells, because it doesn't really get there. It stays in your gut. So that's, I think that's an important point with a lot of this research too. In vitro means in a test tube, right? And that does not always correlate to in vivo, which is in the body, right? So I think it's interesting, but again, I think it pretty much stays in the gut. So I don't know if I've ever really seen stevia cause a big Herxheimer reaction in anyone. It's possible, but I think
it's part of the counter protocol, right?
Yeah, it is. And I usually use it when people need to help get those herbs down, just from a flavor standpoint. But yeah, in the gut, it's going to help with biofilm, so it's beneficial on that point as well. But if we could get it into your cells, we might see some different effects of it.
Yeah, we had another question that I really wanted to address because I think it's an important one. And this was from Bunny Ducko too, who said if he just got a diagnosis of Lyme disease, can he ride it out, or does he really need to treat Lyme disease? And my immediate reaction is like, well, I think you need to treat, of course, right? But then it brings me to Dr. Marty Ross's point when Jenny Bottaccio and I interviewed him a couple of weeks ago. He said, look, there are some things in some cases where I find, hey, look, you have a really bad fungal problem, or you have a really bad, case of Rocky Mountain spotted fever. And if I can address that, your immune system may manage and battle the Lyme on its own, right? So I guess, first off, if you have a Lyme diagnosis, can you just say, hey, my immune system will deal with it on its own? Or if that's not the case, maybe should we be looking at other things that may be more prominent? And if we do that, Lyme will be easier to manage, by our immune system on its own.
Yeah, there's so many layers to answer this. I think, and this is just my opinion. I don't necessarily have any science or evidence behind this, but I feel like there probably are a lot of people walking down the street who have Lyme and have no idea because they're managing it, right? In finger quotes. They can chalk up their fatigue to, being busy, or their pain to be getting older, or, what have you, but they're okay, right? Until they're not, right? But there's some people that are just okay. They're okay with it, right? Because their system is managed to kind of keep it there. And in that sense, I really think that trying to eradicate every single last spirochete from your system is futile. That is not where I want to put my energy and effort. I want to get the immune system to be strong enough to be able to keep it in its pretty little box and leave me alone, just like my chicken pox in its pretty little box, leaving me alone, right? So, you know, there's so much to it. So I agree with Dr. Ross. Like, I'm not always treating Lyme, but that's part of that prehabilitation conversation we were having earlier too. If I can get the gut healed, if I can get detox supported, if I can get the nervous system to calm down, a lot of times symptoms get better and labs get better because we freed up space for the body to be able to handle more and get everything into its pretty little spot better, right? So I don't always have to aggressively treat Lyme disease. And I'm using more and more herbs long-term too. Not even in like high dose kill doses, but more like maintenance, sweep the street doses for, I'm like, you feel good, stay on it. Like, you know, like Dr. Rawls, he's never going to stop his herbs, right?
Never.
Like, you know, like, and
Yep.
it is really, really safe to stay on these things, right?
Nor
I mean,
will
I
I.
hope I can be windsurfing at his age, right?
Seriously.
You know? Like, you know, just bow down, right? It's pretty awesome. So do you have to treat it? Not 100% of the time. Do you have to address it and deal with it one way or another? Yes. Because if you don't, you can end up with Alzheimer's.
Yep.
Right? You can end up with all these issues. So but it's not necessarily about full-blown attack, right? It's more about healing and repairing. You need that.
Well, but
that cell to.
But isn't prehabilitation treating, right? I mean, why do we have to call treatment only killing? Why is it only going to be antibiotics?
Yes.
Couldn't it be a number of other things? And treatment is really just engaging in sound practices, sound health, healthy practices, right? And there's another piece of the gut health that I just wanted to ask you about, which is, of course, we talked a little bit about the emotional and neurological piece of this, but of course, most of the serotonin in your system is at least stored in your gut, but probably generated in your gut. And of course, your immune system is in large part, again, I understand it's a complex system, but in your gut as well. So if you're treating your gut first as part of your prehabilitation, you may be in a position where you're putting yourself in a position where you have changes in your neurological and emotional systems, which then could calm down the fight or flight, which then puts you in a position where you're more likely to have immune health and immune management of 100%. All the bugs in your system.
Exactly. Yeah. And I think that's part of why it's hard for some doctors to wrap their head around this too, because it's not just an infection, and it's not just about taking an antibiotic for 2 weeks or 30 days. It's just so much more than that. And to really, really heal, you have to look at all those different aspects. And so attack mode and kill mode is a part, but it's not even arguably the biggest part for a lot of people. It's all about doing all the other stuff to heal the system.
Pivot to another question. We had so many. I want to try to get as many as possible. And one of them was around heart rate variability. And I think that's kind of related to our discussion of nervous system regulation and how it can be used from a biofeedback standpoint. Can you just explain first, Dr. Kelley, what is HRT or heart rate variability so we can understand it at a simple level, and then maybe recommend some resources or tools people can investigate to see if it's something worth their while in their healing journey?
Yeah. You know, we used to think that as adults, you had like one rhythm of your heart. We know infants, babies in mama's belly don't. That's why we monitor them. And there's this, you know, natural curve related to mama's breath and contractions and all these other things. And what we used to think it was much more rigid as an adult or a child. It's not. Like, there is a variability in our heart rate, and it has to do with our breath and our stress and our mental state and all of these different things. And so, yeah, this is another great way to try to get your system and not only your heart, but your nervous system and your immune system into a more relaxed and calmer state. Heart math is the best one that I really am aware of. It's not that expensive in the grand scheme of things. I mean, all this stuff is expensive, right? We spend all of our money on this. You just like a little earlobe device that you connect to your phone, and 5 minutes a couple times a day, you use your breath to get your heart rate down. So it's biofeedback as well. It's not neurofeedback. It's not technically on your brain, but it is a biofeedback using your body's rhythms to change your system. And it can be rather effective to really get things down. And what I find interesting about it is it's almost contagious. So if you walk into a room with someone who is in a very zen state and their heart rate variability is very calm and green and open, if you walk into that room, your heart rate variability will join theirs. Like, it's pretty wild.
That's cool.
What can do. Yeah. So find that zen heart rate variability person here.
So this is going back to this electron conversation we were having, and not only is the electron something that we have from the standpoint of being energetic beings and having a mitochondria, generating energy, but now we are exuding energy and we're receiving energy from other people and other sources with the waves that are around us that we can't
I'm very
see.
empathetic too, so I'm very aware of that. I feel like a lot of Lymies are too, and they don't even recognize that they're getting anxious because someone around them is anxious too. So there's a lot of learning to like control that and kind of keep my space and hold open space for my patients, but not absorb all of that energy on myself too. And I know that it sounds woo woo, but man, it's for real. And
but it works, right? I mean, if you talked to me 10 years ago, I would have been like, all this stuff is crazy, but it's changed my life, truly, So, but on this note, I want to ask you a question, because I think this is I was never as sensitive to stress or overstimulation before getting sick and getting Lyme disease. So I've had to implement a lot of techniques in my life where I feel stress coming on, or I'm in a stressful situation in my personal life or my professional life that I can do, that are either so nobody knows. I could be in a meeting and do it internally and have a calming result. Or if I'm by myself, I have some techniques I can do to calm myself down. What is something you'd recommend, a very quick and simple technique if somebody's feeling overwhelmed, depressed, anxious, or just defeated, that they can do to just balance themselves out, that we can implement every single day of our lives?
Ooh, good question. I mean, one simple thing is just to take a deep breath, put your hands on your heart and say, I love myself, and just take just a couple of deep breaths. And I tell people you can do this when you're in the bathroom. No one has to see you do it, you can do it when you're in a meeting. No one has to know that you're going.
Is it true? Is it true the exhale should be longer than the inhale to get the optimal nervous system regulation? We've heard that, and I'm not sure how valid that is.
Yeah, generally, I remember 4 and 8. In through your nose for 4, out through your mouth for 8. 4 to 8 times in a row, 4 to 8 times a day. There's also more box breathing where it's like 4 in, hold for 7, breathe out for 8. As a babesia person, holding my breath never made me feel good. Always made me feel worse. So I never really held it. So you have to, adjust and modify according to what's going on for you. We're not good breathers.
We are not.
In our culture. We're not. We use our shoulders. We don't use our diaphragm. And so most of us are very shallow breathing anyway. So yeah, if we can just take a few seconds and maybe even instead of your heart, if you want to hold on your belly to make sure your belly actually expands with that breath, you're going to get more from it. But yeah, that exhale longer than the inhales where a lot of that magic happens to really relax.
Your humming recommendation from your Lyme hack, I literally do that every day driving to work, and it is just like blissful. It's just the most relaxing thing. And it sounds so silly, and I probably sound like ridiculous, right? But you just deep breaths in and you hum. Richard heard it, and you just hum really loud. The more vibration you have, the better it is to stimulate the vagus nerve, right? And for me, it's just an awesome experience to do that. So another quick question though from the community is we had KJM Riley, and I believe that they're still on. And asked it again in the chat, is what impact does chronic Lyme and chronic illness in general have on metabolic health? And, how can we curb that and balance that out?
I mean, Lyme has an effect on every part of our health, right? And so it's really going to affect our ability to digest our food, make and break down sugar. In and of itself, it can have effects on our heart and in our heart rate variability, but also just our heart muscles, etc. So, and it makes us tired, so we don't work out or exercise maybe like we should, or, you know, I mean, the list goes on and on, right? So it really affects every part of it. And so it's just a big piece of the puzzle that has to be worked on and healed.
I want to ask you a controversial question because I had one view, and I'm always having my eyes opened up by people. So the Lyme vaccine, and I'm always anxious. We've heard so many stories. The first one I can remember is being Michaela Vacher, who got the HPV vaccine, and that was her trigger for chronic Lyme. And it's been an uphill battle for so many years since, and thank God she's doing amazing now. But the Lyme vaccine that's now out, I mean, I think it's Pfizer and Valneva, right? Who are they're very close to having something out to the general public. My thought is, well, that's just Lyme disease. It's, to your point earlier, it's Borrelia burgdorferi. And when I made that argument to Dr. Ross again a few weeks ago when we interviewed him, he said, well, Matt, be careful because yes, it's just Borrelia burgdorferi, but if we can prevent that from a reinfection or prevent that from somebody, maybe the scale won't be tipped and maybe they won't become chronically ill. Or maybe that's enough for their immune system to kick in and help them do what it needs to do, but it couldn't because it was so burdened. It's like, what is your view on that? Because I was so negative, but Dr. Ross really gave me an opposing view that I think has a lot of validity to it as well.
Mm-hmm. I don't know if there's a right or wrong here. I think this is more of an individualized answer and process that you would have to go through. Like if this comes out, you know, one of my questions will be, how often do you have to get it? Do you have to get it every year? You know, is this kind of like the flu shot where we just kind of have to keep going, and how many do you want to do? You know, I think everybody has to weigh the pros and cons. And yes, it could potentially, like Dr. Ross say, lower the overall burden, which is awesome. But on the flip side, you could have a potential vaccine reaction, and you just don't know what you're going to get, you know? And if you are someone who has had a vaccine reaction in the past, you know, do you want to do that? I don't know. There's not, you know, long-term safety data on this right now, to know too, like what are the potential risks? I don't know. I haven't seen any of those listed out for me yet. You know, where are those at? So I think you have to just kind of, you have to take these potential treatments or preventions as a piece of the puzzle and do what makes sense for you. Talk to your doctor, decide what makes sense. And if it makes sense, do it. If it doesn't make sense, don't. You know, I'm not an anti-vaxxer. I'm also not an only vaxxer. I think you have the right to make some decisions here medically for yourself. And I think you should be allowed to do that.
There's a piece of this that makes me anxious about the vaccine, and this is for folks who are not yet chronically ill from Lyme. But what can happen is you take this vaccine, you're then less cautious about how you behave when you're in the community. You think you're going to be protected from this polymicrobial disease when it's only one strain of one bacteria that you're going to be protected from. So in addition to the challenges that I think it may create for folks in the Lyme community and folks who are not yet chronically ill because it may trigger the illness as a result of a vaccine reaction, I think it's also dangerous because it makes it more likely that people will be less responsible when they're in, when they're in the wild, and they may not be taking the precautions they need to take to protect themselves.
Yeah,
from the
that's true. You're not going to be bulletproof
infection
from all of this by the vaccine, so that's a very, very good point. And I would worry that people are, don't wear their protective gear, don't use their tick spray, don't do their tick checks because it's no big deal, or they get a tick bite and they don't worry about it because they got the vaccine, so they're fine.
We have another, this will be our last community question, but we have a question from Kelly A. Scott 08, who said that she has been treating Lyme for a year and she's doing really well, feeling much better, but the knee pain is so bad that she's unable to really walk at all, really, beyond just, some basic movement around. And I can relate to that. I had exercise intolerance for, oh my goodness, at least 8 years. And for me, it was really calming down that inflammation and the autoimmunity response. That was key. And for me, it was back and neck pain. That would be debilitating if I went for a long walk or tried to do a jog or a run. But what is your advice for people like Kelly and myself? We just had a really hard time getting back to movement after, trying to overcome Lyme disease and trying to get our health back.
Mm-hmm. Well, it depends on kind of where that pain is. I think once we get to a spot where it may just be a knee or both knees or something a little more localized, things like ozone injections or PRP can do wonders to repair that joint because they're just damaged, right? And it needs to be healed and repaired. And sometimes all the pills in the world aren't going to fix it. You need to kind of get in there in that joint and really repair it. So that's where Dr. Agarwal, for example, at our clinic comes in, because she can help really kind of get there and repair. And that these are things that are going to stimulate healing of the joint, not just lower inflammation, but actually work on regenerating the joint. It's a little harder when it's all over back pain, but you can do trigger point injections, things like that too. Sometimes it's just more, it becomes anatomical, not so systemic, if you will. It's not systemic, but you understand, you're following my train of thought here. Yes. Okay. So sometimes you have to do some localized treatments to remind the system that it's not done working on that joint or that neck or that back or what the spot is. And that can do really wonders. And then once that knee stops bothering you and you're able to walk a little bit and build and grow, like that can be very, very life-changing.
So Matt, so we can let Dr. Kelley get back to her family. She's been kind enough to work with us for the almost an hour. So Dr. Kelley, in the last 3 minutes, can you talk to us about what you see on the horizon and what is exciting you?
I'm always looking for new and innovative things that are safe and effective. So I talked about frequency specific microcurrent. We're also looking at red light and laser options. We do a fair amount of methylene blue. You know, we're always just trying to kind of find different ways to help people get better. And I think there's more and more immunological support stuff that's coming out, and some of the long hauler stuff is also working on the Lyme patients. No surprise to us, right? Yep. But to have those tools and have that availability, it's expanding that toolbox even more to help people get better faster. So, and SOT, that's another one we're using. You know, I'm always using new stuff and trying to help people get better because everyone needs something different. We have to approach it differently for everybody. But like I said, I'm excited. I think there's some really cool stuff coming out, and we're making some progress. And this is reassuring and good. It's going to take forever because that's how the medicine world rolls, but we're seeing momentum and it's a good shift.
Rich, I do want to ask one question about SOT, because we had a doctor reach out recently on TikTok of all places and tell us that, you know, he believes SOT is the solution for the Lyme community, and that SOT is something that can address at least 95% of chronic Lyme patients. And I think SOT has value, but again, it makes me anxious to think that 95% of Lyme patients can take SOT and just get their lives back. So what are your thoughts on that, Dr. Kelley? I just have to ask.
There's just no magic bullet, right? And I think from what I'm gathering, from what I'm learning of getting into the SOT, and I researched SOT for a good year and a half before we started using it here. There certainly are clinics who are just like, yeah, come in, get it. No, you know, it's a piece part of the puzzle, and at the right time in the right place, it can be a game changer, you know? But is it right for everybody? No. Are you going to get the right bug every time? Probably not. You can do one bug at a time, right? And so it's a plethora of steps. So, you know, how many do you have to do to get them all? Like, you know, we're still figuring all of that out. But I think for the right patient at the right time, it's a game changer. Absolutely. Yeah. But 95% of everyone all the time, you can't say that in the Lyme community. We're too unique.
And it's crushing when you think something is going to be the answer and it's not. It sets you back, right? Because the emotional state you get in a funk, and then you maybe aren't thinking logically, you aren't taking proper steps to move forward next in your journey, and it's really, I think, not a good way to approach healing. So
Matt, and then of course the repeated disappointment and the impact that has on you emotionally, which then has that same impact on you neurologically and your immuno responses is just a challenge that we can't ignore. So I think it's great, as Dr. Kelley said, that we add another tool to the toolbox, and we consider using all of these tools in different ways. But I think it is irresponsible for any practitioner to hold out a particular therapy as a cure-all for everyone. It really is, in my view, irresponsible.
I'm not going to disagree with you.
Well, I'm sorry. I digress. I know. So we are exactly at 8:00. Dr. Kelley, you know you're one of our favorite doctors in the world. You know that you are going to be back every year if you're willing for Lyme Awareness Month. We will have you back time and time again for the Lyme Hackathon, for these lives, for these really informative discussions, because, you know, there are very few people who are making true change in the medical field, especially in the MD arena, for chronic Lyme patients. You're one of them, and we refer you out to people all over the world, believe it or not. And it's just, you know, I tease, you know, I'm like, look, Rich had to treat with somebody for his tick bite. Who did he treat with? Dr. Kelley. that's who we recommend. So we can't thank you enough for taking time out of your busy day. And we know it's Lyme Awareness Month and you're doing, oh, also congrats on being on the news as well. I mean, we saw you on the news. That was so cool. So that was a really awesome, really cool thing to see. And just thank you again. I know, Rich, you want to say some concluding remarks too.
Again, thank you, Dr. Kelley. As always, you're not just one of my favorite doctors, you're one of my favorite people. You're a blessing every time we get to talk with you. So thank you again for joining us.
This is my pleasure, my honor, you guys. I love you as well. This is so much fun. I look forward to it every year. So let's keep it going.